Time to start getting answers about the coronavirus from our local expert.
Dr. Erika Hamilton, a microbiologist from UMass Amherst, joins us now. Hey, Dr. Hamilton, hope you're doing well. We'll start here with Moderna beginning that phase 3 vaccine testing. So the question here for you is, what will doctors actually be looking for here as they start administering it?
So they're looking for a couple of different things. First of all, they're going to keep an eye out for side effects. Now, vaccines that have made it through phase 1 and 2 of trials, any of the really bad, obvious side effects, they have already eliminated those vaccines, but occasionally something, a rare and severe side effect will be noticed in phase 3, so researchers will be looking for that. But mostly they're looking for, does the vaccine work? So volunteers have been given 2 doses of the vaccine 4 weeks apart, and then they're sent out to live their lives as normal. And they're tracked for, did you come down with COVID? And if you did, were the symptoms severe or did the person die due to COVID? So does the vaccine work and is it safe for the majority of people? That's the stuff that they're looking for phase 3 clinical trials.
A lot to unravel when it comes to that. All right, switching gears now. We first told you yesterday, Governor Charlie Baker announced that there were more free testing locations throughout Western Mass. That includes Agawam and Springfield. So who exactly should get tested?
For these testing centers, anybody can go. So they have been instituted in places that have had a reduction in testing and a very slight uptick in the number of cases. The testing is free. Anybody can go, so you don't need signs or symptoms, and you don't need to know if you've been exposed to someone with COVID or not. And it is not restricted to where you live. So even though the testing center may be in Agawam, it's not for Agawam residents. It's for anybody. So if you are concerned about whether or not you may have COVID-19, you can go to one of these testing centers and be tested for free, and if you have no symptoms.
It's very good, too. And to see them west of 495, that was obviously a big concern with a lot of people out our way. So we'll keep you posted once we find out when you can actually do it. So with Major League Baseball already postponing games, how difficult do you think it's going to be for sports to actually complete a full season?
So Major League Baseball has set out a very long list of safety rules for their players and their staff. So it's things like when the players are in the dugout, they have to wear masks. They can't spit. They can't share equipment. Baseballs will be disinfected. There's no high-fiving, things along those lines. Hopefully this will either slow or stop the spread of COVID-19 for the players and for the people who work with the players. Different countries like Japan and South Korea, where baseball was also popular, have started their season, and they're using similar regulations and rules like this. And so far, they have been okay. So hopefully, as long as the players and staff follow these rules and regulations set out by Major League Baseball, baseball will be able to continue and hopefully be able to finish.
Let's hope. As we mentioned, the Red Sox playing tonight. All right, Dr. Hamilton, thank you so much for joining us today. We look forward to more of your insight in the coming days. And be sure to tune in each weekday at 12:30 for Coronavirus Getting Answers, as we have a doctor answer your questions about the ongoing global pandemic.